Hey everybody, welcome to our webinar. It's going to be about balancing step 2 and COMLEX level 2 preparation with clinical rotations. And my name is Dr. Alina Hill. I'm a general surgery resident and I'm a senior tutor at Elite Medical Prep. And with me I have Janet.
Hi, everybody. My name is Dr. Janet Tam, one of the senior DO tutors here with Elite Medical Prep. I'm a diagnostic radiology resident. So welcome to our webinar today. A little bit about Elite Medical Prep. We have some longstanding partnerships with medical schools around the world. And on the screen here, you can see some of the partnerships that we have. We offer a wide range of services. Most specifically, we got one-on-one tutoring. Also, we have customized programs for all the board exams, STEP, and the COMLEX, shelf exams, MCAT, residency matching, and also advising for medical admissions.
All right, so key components to achieving success on step 2 and on COMLEX level 2 come down to really 4 things. One's time, 2 is high yield resources, 3 is practice exams, and 4 is study calendar. And today we'll be discussing all of these things and how to manage and incorporate them during your studying for step 2 while you're doing clinical rotations.
And so it's important to determine first how much time you'll need. Average dedicated period that schools give is about 6 weeks, and it widely varies depending on what school you go to. So we always recommend starting with a practice exam to establish your baseline so you know what to work on. Definitely one size does not fit all, and that's why we have a one-on-one tutoring. And you should plan to study at least 8 hours daily. I like to tell people to treat this like a full-time job. Ideally, if you can, study more than that.
Yep, and this is going essentially for your dedicated study period, which you will have after you finish clinical rotations. So when you're creating a study schedule, especially during clinical rotations, it's very, very important to create this very well ahead of time. So I recommend doing that before you actually start your rotation. So maybe a couple of days beforehand, kind of take a look at how many questions you're going to need to do during that rotation in preparation for your shelf exam. And really, when you're preparing for shelf exams, you're essentially also preparing for STEP and for COMLEX, because the material that's going to be on the shelf exams is really the same material that's going to be on step 2 and COMLEX. Sometimes the shelf exams do go a little bit more in depth and detail for that specific subject than step 2 or COMLEX level 2 would go, but the questions are still very similar. So essentially figure out kind of how many questions you need to do, and ideally you want to finish all the questions for that shelf and for preparation of that shelf exam about 1 to 2 weeks before your shelf exam. And this will be good because it will actually allow you time to address any of your weaknesses. And make sure that you're always communicating with your preceptor when your exams would be. Preceptors don't really get students, they don't receive like student schedules, or if they do, it's very easy for them to overlook that because, understandably, doctors are pretty busy. So always kind of make sure at the start of your rotation, hey, this is when my shelf exam is going to be, this is when I'm ending my rotation, just to make sure that they know. And sometimes they may, if they know that it's like your shelf exam week, they may even let you off a little bit earlier so that you can go and study for your shelf exam. So this is really important. Overall, other important things to consider with scheduling and planning, you want to plan very early on in your 3rd year based on your rotation schedule when you want to take your step 2 and level 2. And in order to do this, figure out kind of how many sub-Is and away rotations you're going to be doing, where are those going to fit in your schedule. Some rotations will actually want you to have step 2 done before you do it, so you're gonna have to kind of check with them beforehand to make sure that you do have that requirement met before you're applying for that particular rotation. And spots do fill up pretty quickly, so you never really want to kind of have to travel somewhere and add all that extra stress around testing with these board exams when it's already so stressful. You want to really minimize the amount of outside stress that you're going to have. So really planning early and booking your exam early will really help ensure that you're minimizing all that other anxiety overlying the exam and can really just focus on studying for it. And as you're making your schedule and studying during your clinical rotations, be reasonable with the time that you have for studying. And this is really going to vary per rotation. So, for example, in rotations such as surgery, you're going to probably have longer hours and won't have as much study time. Whereas, for example, rotations like psychiatry, you may have a little bit more study time. And also account for the time that you will be commuting. And sometimes students have rotations that require a longer commute, so that will also be taking away essentially from the time that you can spend studying. So which is why it's so important to plan early and start studying early on, really as early as the first day of rotation, or even doing a little bit of review before that as well. The earlier you start, kind of the more time you have, and because just know that there will be days that you will be tired, right? Especially when you're kind of going on rotations. It's a very different change from just being able to study all day during M1 and M2. So here you're going to be working, and then you're also expected to still be studying for these shelf exams. So if you plan early and you start studying early, you're going to be all the better prepared. This is really kind of not something that you want to wait until halfway through the rotation to start studying for your shelf. Another thing that I think really helped me when I was on rotations is really learning through patients. So this is essentially like killing two birds with one stone, because by learning from your patients and the diseases that you're seeing on the wards, you're also learning the material that you're going to need to know for your shelf exams and for step 2 and level 2. And it's obviously a lot more memorable when you can relate it back to the patient. Like, I feel like even now there's patients back from even when I was the 3rd year or 4th year medical student that I can still remember so clearly and remember those disease processes so well because I had that patient that I'm able to relate it to. So really, the more you can integrate all your learnings, the better off you're going to be. It's going to help you retain things better. It's going to help you be better prepared, and it's going to help you be better clinically as well. So this kind of knowledge for shelf exams and for clinical rotations, it really goes hand in hand. Like, yes, some things are, more high yield than others, but if you have a good understanding of the pathophysiology, diagnosis, and treatment of the disease, that's the type of stuff that's going to show up on your shelf exams and on your step 2 and level 2 exams.
Thank you, Lena. And obviously going off with that talk of, you're going to have limited time now, given that you have to spend some time with your clinical rotations, it's important to select the right resources and make sure you're not overwhelmed with a lot of resources. So you want to really limit it to, 3, maybe 4 resources that work for you. And everybody has a different learning style. So it's important to pick one that works for you. Of course, on the top of the list is to do practice questions. That is really where you're going to get a lot of your learning from. In addition to that, it's important to incorporate spaced repetition. So in the form of flashcards, some of you probably know about Anki. It's a spaced repetition program. It forces you to learn certain topics, and they space it out for you based on your understanding and how comfortable you are with the topic. So it's important to get that repeated learning in. And again, start daily practice questions early. If there's anything to take away from this webinar, it would be that. So some commonly used and recommended resources, I would say mostly for Step 2 and COMLEX 2, they're going to be very similar. Question banks are usually recommended. So UWorld and Amboss are some good question banks for Step 2. Some video lectures are Boards and Beyond and Online MedEd. For the Level 2 specifically, for those that are taking the COMLEX Level 2, we find that the TrueLearn or the ComBank question bank is most similar in style to the actual exam. So if you plan on only taking Level 2, that may be a good option for you. Some videos that you can watch are Dirty Medicine OMT series that you can find. They're free on YouTube. They're great OMT review. The OMT Savary's Green Book is a highly recommended overall review book for COMLEX. And most importantly, focus on the most heavily tested OMT materials. The 3 listed here, viscerosomatics, counterstrain, entrapment points, and not to neglect that and not to push that off to the end. So we'll get some of the Q&A started a little bit early. Listed here, we put some of the most commonly asked questions. What if I run out of questions during my dedicated study period? Then you can always just reset your question bank and during your dedicated time and do other questions on random, all subjects. A second question that we commonly get is, as a DO student with limited time, which question bank should I use? So if you're taking both the Step 2 and the COMLEX Level 2, I would say it's probably best to focus on one question bank first, and I would say the recommended one is UWorld. And now UWorld has an OPP section for their COMLEX Q banks as well. Although that UWorld has that section, ComBank question bank is probably preferred over that for your OPP practice questions. So if you're only taking COMLEX Level 2 and not taking Step 2 CK, then I would say stick to the TrueLearn ComBank question bank. And some people ask me as well. I often find it difficult to do spaced repetition learning. I don't have any time to squeeze that in. Any tips on that? This comes back to managing your time well and making sure that you prioritize it. Perhaps you can set a block of time before your clinical rotations just to focus on it, or you can just download Anki onto your phone and do flashcards during your breaks. And you'll be surprised how many flashcards you can get through by just doing a couple during your breaks. They really add up by the end of the day. And obviously, it's also very important to make time for practice exams. It's the best way to objectively measure your readiness for your boards and for your shelf. So as Alina talked about earlier, studying for your shelf exams is studying for your board exams. So for NBME shelf practice exams, there are exams for each of those rotations and shelves that you're going to take, that you can take those practice exams, and you should start early on those NBME shelf exams. You should start earlier. You should take those practice exams maybe 2 to 3 weeks before the actual shelf exam, and then space them out and plan to do at least one per week until you take your shelf exams. So for the board exam overall, once you're done with shelf exams and now you're in your dedicated time, when you're studying for your Step 2 CK or your COMLEX Level 2, you should also be doing practice exams. And you should take at least 3. One should be as a baseline to see where you stand. It helps you gauge your readiness. It helps you build your stamina as well. And probably, take 2 additional exams prior to your actual test day. So at least 3 practice exams is recommended. And the biggest thing is you should always review your practice exams after finishing them. Your review process is really where you get to learn the content, learn where you went wrong, and find your weaknesses so you can work on them more. and you should expect to spend a bulk of your time reviewing afterwards.
Yes, thanks, Janet. That's absolutely true. Really make sure that you review those practice exams inside out. I think sometimes I see students kind of just do the exam, sees the score, maybe kind of briefly look over the answer choices, but really kind of study the exam, study the question structure, study kind of the patterns. How do they ask about certain condition? The NBME practice exams is really the closest thing that you're going to have to the shelf exams and to step 2. So really kind of picking up on those things. How are the questions structured? How are they going to ask me about every condition? You know, what are my weaknesses that I need to work on? Really answering those questions after every practice exam that you do. And even throughout while as you're working through practice questions it's so important. Um, and this is one of my favorite slides that there is. So passive versus active learning. And this is something I think I struggled with initially when I started medical school too. And my studying was just so inefficient because I would just spend so much time kind of reading, reading through first aid or reading through lecture notes or, just watching videos and really not enough time doing active learning. And I see students make this mistake so often. But as you can see here, active learning is going to help you retain so much more information than passive learning. Passive learning feels good. So when you're kind of reading over things or watching a video, it's so easy to really reassure yourself, oh yeah, I know this stuff. I'm so familiar with it. I'll be good when I'm tested on this. And it's really easy to tell yourself that because you're looking straight at the material. So of course you're going to feel like you know it. But it's really not until you put your knowledge to the test that you find out, okay, do I actually know this? And what gaps in knowledge do I have that I need to address before the exam? And that's where your questions, your flashcards come in, or even, creating your own like visual aids, like your own diagrams, your own charts based on the questions that you're getting wrong. Creating your own cards too, just the whole process of having to think about what am I going to put on this card and then putting it on a card front and back, just that whole process will really help you retain the information better. I know there is pre-made decks too. Overall, I think if you're starting off, you're studying early as you should have time to make your own cards. I know that's sometimes a concern, and it does require that little bit of investment up front, but really going through that process and making your card will help you retain so much more information than just kind of looking through the information. And yeah, practice questions. Start these early. Kind of every time you have a shelf exam, like you should be starting these questions at minimum sometime during the first week of your rotation. Ideally within your first day or two you should have started your questions, and if you start them early enough you're not going to have to be doing that many. Like it comes out to really being like 5 or 10, depending on rotation, 5 or 10 questions a day. Like that's totally doable. But if you start doing them late, then it comes out to, okay, now I need to be doing 40 questions a day just in order to finish the questions before my shelf exam. And that can create a lot of unnecessary stress. I know there's also a misconception of kind of, oh, but I haven't really reviewed the material yet. How am I going to kind of do practice questions on this? Well, you get to review through the practice questions. And like we talked about earlier, it's so much more memorable when you can relate things to the patient. And the similar thing goes for questions. It's so much more memorable when you can relate it to a vignette of a patient versus when you're just kind of reading or passively watching videos of just information that you don't really kind of have a place for. So be okay with missing questions, especially at the beginning of your studying. The important thing is to learn from these. And as you've probably heard, use UWorld, use your question bank as a learning tool rather than, oh my gosh, I missed these questions. You don't use it kind of as your evaluator. So your NBME practice exams, those are good things to essentially use for your evaluation. Okay, where am I? Versus the practice questions, those are best used as your learning tool. All right, and I think we can go ahead and start our Q&A early, and I think we even have a couple of questions already. So please, guys, if you have questions, please drop them in. You can drop it anonymously too, so we don't really see your name, so nobody knows that it was you asking, and we will be happy to answer them. And I know there's one here about which Anki deck for step 2. There is like the on keying deck that a lot of students like that wasn't really present during my own studying. I did this a few years ago, but overall, yeah, I really do emphasize making your own cards. Those cards are made for you. They target your weaknesses versus going through kind of a pre-made deck. It can be really overwhelming, and you're going through a lot of cards that you know and don't know. So essentially, you're spending some of that time reviewing stuff that you know that could rather be spent reviewing your weaknesses. And it's super important. Whenever you're studying, you should always be studying things that you don't know. You should really maximize your study time. And this is especially important during clinical rotations where you really don't have a ton of leisure time to study like an M1, M2. So you really have to prioritize studying and learning the things that you don't know and that you're weaker in. And creating your own cards really will help you do that.
Yeah, I agree, Alina. I've had a lot of students that tell me they're try to use like those large Anki decks. I think one of them is Anking. That's what everybody knows. But those decks have thousands of cards, and there's thousands of cards that you did not make on your own. So you don't know the thought process behind it. And I always tell people it's maybe you can learn all this information through all this, memorizing Anki from reading, from videos. But the biggest thing about this exam is being able to apply it. And it's going to be very hard to apply it when you don't know what the test writers are thinking and how they phrase the question. And this comes into more of the test taking strategy part as well. And so it's very important to do the questions to really analyze them and find out, what was missing in your own content gap, or even, a problem with test taking. Maybe it's you read the question too quickly, or maybe you didn't understand what a certain phrase meant. Those things are important things to put in your Anki cards, your own personal deck as well, to remind yourself of what you need to work on. So definitely, I'm a big fan of making your own Anki decks and doing the questions.
Yeah.
I see I have a question here about, hi, Dr. Tam. Can you please give us insight on how to match diagnostic radiology? What can we do in resume to be outstanding to match into the residency apart from a good score? So I think this question can be very generalized to all specialties, right? To match in any more competitive, so to say, specialty, of course, number one is going to be your score. They want to make sure that you can handle the rigors of residency and to be able to learn all the material, right? And especially in diagnostic radiology, because it's essentially a giant test. Every time you read an image, you're going through the pathophysiology in your head. You're thinking about how anatomy looks. So, apart from a good score, I would say really doing well in your clinical rotations. Again, it comes back to, hand in hand with doing well in your clinical rotations. That may help you get a good score on your shelf. That may help you get a good score in your board exams. And I think now that with this new change, the step 1 and the COMLEX level 1 being pass fail, they're starting to look more on the step 2 and the COMLEX 2 scores. And I believe they're also probably going to start looking at your shelf exam scores as well and how you do on your clinical rotations. Getting good letter of recs is very important. Having your mentors that vouch for you. I think especially for diagnostic radiology, it's a small field. And so having a great letter of rec is really important. I think, of course, having some research also helps as well. It shows that you're interested, and it shows that you're interested in helping advance the field. So definitely try to get some research in. And lastly, I would say your away rotations also matter. I think there's many reasons for that. You can show your knowledge, you can show that you can get along well, that you're someone that they want to work with. Definitely helps you show interest to programs that you are interested in. Secondly, I think it also helps because it allows you to see for yourself if, that program is something that you want to do and that program is something that you want to go for. So I would say really get hands-on, get a mentor, someone that can help you with that and walk you along that process can help a lot.
Yeah, totally agree with what Janet said. I think mentorship's super important. Um, and overall, speaking kind of to mentors about research as well. So I think a lot of like my mentors were people that I worked with in research in surgery that I think it was good because they could see me in research, but then also when I was doing my rotations, they could see how I perform clinically as well. And those were essentially some of like the best letters that I got. And letters are super important. I think my letters were put up at every interview that I had, and they even like mentioned knowing some of my letter writers. So it's very important to build those relationships, or if you haven't yet, then to do it during third year, which is actually a great time to do it because you're out there clinically, and anyone that you kind of work with clinically, you can ask to see if they in the specialty you're interested in, you can ask to see if they can be your mentor, if they have any research that they would like help with. So, which is essentially what I did for one of mine. So it works really well. And then, yeah, absolutely, score is important. Making sure to do well on your rotations, but if you don't honor every single rotation, it's not gonna break you. You don't have to honor every single rotation to match in a competitive specialty. But try to do well and try to do well in your shelves, and really doing well in your shelves will prepare you to do well in your step 2 as well. And
Yeah.
then we have
So I think specific to diagnostic radiology, something just came to mind is actually on some of my away rotations, instead of, it's really hard to, I guess, show your knowledge clinically in this setting of diagnostic radiology. You're sitting in the reading room and you're just reading films. So a lot of these array rotation actually have quizzes at the end of it. And they test your knowledge on basics of radiology. And I would say one of the books that I recommend is called Learning Radiology. And you can find this online. You can just Google that. And it's an amazing book to show you the ropes and kind of the basics of that. So I would definitely read that and learn everything in that in preparation for that.
Nice. Yeah, that's a really great tip. And I think a mistake sometimes students make is not actually like preparing once they get to like their fourth year away rotations, but it's almost even more important to be prepared during those because your away rotation is essentially a 1 month long or 2 week long, however long it is, interview at that program. So if you do stand out, and they would rather kind of match somebody who they know who looks good versus somebody they haven't really met. So those away rotations are really a good way to showcase yourself and do it at programs that you would want to match it. And then I know we have a question here. If taking a step and level, which one would you take first? So first, we would recommend taking step, and that's usually what I tell my students as well. And then give it probably a week or so until you take your level 2. And this is good because during kind of that week in between your step and your level 2, you can actually, study more of the stuff that's going to be on level 2, right? Like the OMM stuff. So I know Janet probably agrees with me.
Yes, yeah. So I always tell my students that when you are studying for the step, you're basically studying for the level exam. So doing well in your step exam, you'll probably do well in your level exam. With just a little bit of some added OMM or OPP practice questions in there, which I would also recommend to do some of them alongside your step questions as well. So I always tell people to incorporate, you know, like 5 to 10 questions per day of just the OPP so that you can get a feel of those questions and not put them off to the end. But yeah, I would say taking it maybe 1 to 2 weeks apart is a good amount of time. That's usually what I recommend to my students. So, oh, I have this question here. The name of the radiology book, it's called Learning Radiology, Recognizing the Basics. It's by Dr. William Herring.
Nice.
I will also type it here.
All right, so you guys should be getting that book in the chat or the Q&A. And then the next question we have is, I spent too much time reviewing your world. What advice would you recommend? So I do have some advice that I can recommend for this, and I will tell you exactly what I tell my students, because trust me, you're not the only one. I've done this. I've seen people do this in their studying, and it can make you feel very inefficient. So what I would recommend is, if it is a question that you got right, and I always recommend when you're reviewing, read the educational objective first. And say it's a question you got right that you knew, and you read the educational objective and it fits with the reason why you got it right, you know, it's material you're comfortable with, at that point you can actually just kind of forgo the explanation or just quickly skim the explanation, so that you're not spending your precious time on things that you already know. What you really want to do when you're reviewing is really target those weaknesses. So then for any other questions, like things you got, things you got wrong, things you weren't sure about, things where maybe like it was a guess but you weren't super sure, I would still start with reading the educational objective. And then I would actually go and just give that question a good full review. So really, by kind of skipping over or very vaguely reviewing the stuff that you knew, you're really going to save yourself that time and be able to put it more towards the things that you didn't know, which those deserve a very good review. And over time, as you're working through questions and getting better, there's going to be less and less of the questions you get wrong. So by nature, kind of your review time for the questions will get, you'll be quicker at it.
Yeah, I definitely agree with that. I think it depends on how far along you are in your study process. In the beginning, you definitely expect to spend more time reviewing just because you probably have more content gaps. And then this also, ties back into using that Anki spaced repetition, right? So I always, just like Alina said, I tell people to look at the educational objective first. Really that's the bottom line, right? That is what the test writers want to test you on. And I always tell people every question has a purpose, right? Every question has a purpose. It's either a pathophysiology of a certain disease, or it's asking histology, or it's asking treatment, or it's asking management. So really understand the purpose of that question and really understand that. So that's what they tell you in the educational objective. And so maybe if you didn't understand that it was a content gap, then you would go into your Anki cards and make an Anki card about that, right? And so the next time you see the Anki card, you'll get that review. And the next time you see the question, you'll get it, right? And you'll spend less time reviewing as time moves on. And I also tell people to just, not spend too much time on things that you do know, even vaguely know, because again, each question has a purpose. If, something is high yield enough, it'll come back again in another form, in another question, right? So really just focusing on the question at hand and moving on. And along with that, I think it helps if you give yourself a time limit. I tell my students to literally get a timer, put it on a screen or something on their laptop. You're going to give yourself this much time to spend reviewing, and it forces you to kind of move along and move faster for those who tend to procrastinate or spend a little bit more time. That may be a useful tip as well.
Yeah, absolutely. Totally agree with all of that. That's awesome advice. Yeah, and for kind of really trusting, going off of what Janet said, really trusting the process. Like, if it is high yield enough, it will show up again. So I sometimes see students kind of falling into this trap of, oh my gosh, there's 5 different diseases in here. I got this question wrong. I need to review all these 5 different diseases that are on here. Well, no, what disease was the question about? That's what you need to go and review, right? You got it wrong because you didn't know that specific disease. And if the other ones are high yield enough, they will show up in other questions. You're going to see them. The great thing about UWorld, they always keep adding questions. And even when there wasn't as many questions, topics that are high yield, they come up over and over and over again. Like if you were to, for example, look how many questions are there in UWorld on AFib, which is a pretty high yield topic, you would probably find like 20. I think I looked this up at some point. There was like 30 questions on just AFib. So that kind of goes to tell you, okay, if you miss an AFib question once, you're going to have a chance to redeem yourself later on when you're doing more questions. It will show up. And that's also the good thing about doing those questions like on random, well, for shelf, you would do it kind of for that specific shelf, but not really selecting any subtopics, is because you want to be seeing these topics kind of at spaced intervals, right? And doing them on random also gives you kind of that similar thing that you get with Anki, where you're getting your questions at like spaced intervals. So maybe you have an AFib question, today, and then, you have another one next week, rather than kind of having them all at once, right? So of course, it's going to be kind of a lot easier to answer all the questions for one topic, especially after you've just reviewed it in a question prior. So really doing those on random as you're going through your rotations. And then when you're studying for step 1 and level 2, or sorry, step 2 and level 2, you want to also make sure that you're doing them on random with kind of all the topics, especially since now you will have gone through that question bank one time as you were studying for shelf exams.
Yeah, and another question going off of spinning off of this question is a lot of people ask me, well, how should I review the questions, right? And I think a lot of the times students run into trouble with understanding the clinical part of it, right? Step 2 and level 2 is different from step 1 and COMLEX 1. It's more clinical. So with that, you'll see there's more I guess, emphasis on physical exam findings. You'll see really changes in vital signs, right? So if there's a fever, then you may be thinking maybe infectious, maybe inflammatory, autoimmune, right? Or like physical exam findings, really focusing on that. For example, abdominal pain, right? They tell you, how does the belly sound? Is the patient having bowel movements or not? Is there guarding, rebound, rigidity? What does that mean, right? So really understanding these clinical findings, I think, is important when you're reviewing these questions, because oftentimes people overlook that and or maybe not fully understand what those exam findings mean. And that really hinders you down the line when you're doing more questions. So when you find that you're not understanding certain terms, it's important to seek understanding of that first and foremost.
Yeah, absolutely. Those are all awesome tips. And we've got our next question here related to UWorld revision, what to avoid during note taking. All right, this is a good one. So note taking. So I don't really per se recommend taking notes, as in like writing down notes somewhere or typing out notes somewhere. That is best put into an Anki card. So rather than kind of typing out, okay, here's the educational objective, or here's this, or here's that, or copy pasting some stuff from the question, that is going to actually hinder you from doing what we call the active learning, right? So you want to make sure that you're putting that information that you missed you want to put it in a format where you're going to be able to quiz yourself. So if it's not going to be with Anki cards, that's fine, but make it in a format where you can quiz yourself. So another kind of thing, if you really, say, okay, cards are not for me, I hate it, make your notes in a question answer format. Have one side of your notes be question, the other side be answer, right? Where you can cover up the answers and still quiz yourself on that. And really what you want to put on that card is, I always tell a student, ask yourself, what piece of information did I not know that made me miss this question? And that's that piece of information that should be going on that card. And if there is multiple pieces of information that, was required to answer the question that you didn't know, then I would make separate cards for those. So maybe, you can even do up to 3 cards. I wouldn't push it past 3 per question, because these cards, they should, or, these question answers, they should be kind of quick and easy and straight to the point, right? Okay, you see the question, you answer it, you're right or wrong, and then you kind of see your answer, and you can actually, okay, I still need to keep reviewing this, or okay, I actually finally know this. So really, that's what you want to put onto your cards or onto your, Q&A notes. I would avoid really kind of copying and pasting paragraphs. Images like charts and diagrams, those are good to kind of put in like the extra information just to have there for reference, particularly like, for example, anatomy pictures. Those are great if you missed kind of anatomy question or the question related to that. Okay, UWorld has this great picture. Yeah, I would probably kind of include that in my extra notes just so that I have a picture to reference it, especially if you're a visual learner. So really, this will kind of take some practice. Another thing that you should do when you are reviewing your questions is, maybe sometimes it's not content. People always say, okay, content, I didn't know content. Sometimes it's not content. So you really need to evaluate, why did I miss this question? Okay, maybe it was test taking. Maybe I misread it, or, I missed that the patient had a fever, and that would have really changed my answer. Well, now I would have been thinking of an infection, but I really overlooked the fever. So really figure out, what was it that made you miss it? Maybe you kind of misinterpreted the question, or, maybe your highlighting wasn't good. You didn't highlight the important things in the question. So really evaluating, why did I miss this question? And if it's a content thing, great, put it on a card. And if it's not, if it's a test taking thing, that I would even note that as well, or kind of maybe even have a little list of things to work on. Okay, I need to work on making sure that, I'm reading the question carefully, that I'm, that I'm making sure if there is a, if a vital that's off, like hypotension or fever, I need to make sure I'm paying attention to that. So really figuring out why you missed the question. And it takes a little bit more of cognitive effort than, simply copying and pasting from the question, but it's so, so worth it. And that's the way that you're going to improve, is really by identifying, where are you going wrong?
Yeah, I definitely agree. I always tell students to stay away from copying and pasting, or, typing paragraphs out, right? I find some students it makes them feel, comforted that they're typing out, the disease, the pathophysiology, the treatment, management, etc., imaging, and all of that in one card. That's just too much information, right? That's inefficient. Just like Alina said, you want it to be quick and easy, more like a quizzing yourself format, where you can just quickly identify what you need and move on, right? And the point of Anki cards is to be quick reviews, right? And you don't want to be doing paragraphs. That's almost like reading a textbook again. So, and it takes more cognitive effort, right? And it's what we emphasized, this active learning, really questioning yourself, what you can do to get this question right the next time. And those are the things you should be putting on your card. And I agree, I wouldn't recommend making too many cards for one question. I think 3 is usually where I like to tell my students to keep it at 3 max. If you can keep it at, less, and it's better. And you don't always have to make cards for topics that right? Maybe you just got it wrong because you read too quickly, or you missed a certain vital. You don't always have to make a card for that. And from, figuring out what you need to make a card for and what you don't, that can help save a lot of time during your review process.
Yeah, absolutely. I totally agree with all of that. All right. Does anyone have any other questions? I think that is so far all the questions that we've got. So please, guys, ask more questions. We are here to answer them. We're happy to answer them.
If any of you are interested in general surgery, maybe Alina can answer some questions related to that.
Yep, absolutely.
If you have any more questions related to radiology, I'm happy to answer that as well.
Mhm. Jenna, what do you usually recommend as a kind of daily question goals during dedicated study period for step 2?
So specifically for dedicated, I would say the question goal is minimum of 80. And usually I do prefer when people start early, starting at 40 and slowly working their way up. But I would say 80 should be the minimum. What do you think, Alina?
Yeah, I totally agree with you. I always have my students start at least at 80 during their dedicated and work their way up to 20 or was our 120 over a period of a week or two. And really as you're close to your exam, you should be doing the 120 a day. And you kind of work your way up from doing them from untimed on tutor mode and really transition to doing more time to no tutor mode sets as you get closer to exam. And I think we actually got a question, how many questions per day would we recommend during rotation? Yeah, it's a great question. So I think, so this will really depend on rotation and how many questions there are in UWorld for that rotation. And some rotations will have more and some will have less. So for example, IM has a ton of questions, right? There's over 1,000 or maybe even 2,000 questions just for IM. And things like psychiatry, there's only maybe like 400 or 500 questions. So really, this is where it's so important before you start your rotation. Look at how many questions there are, and then give yourself at least a week or up to even 2 weeks before your shelf to essentially have all those questions finished, right? Because then you're giving yourself that week or two to review your weaknesses and maybe even look at through some of your incorrects or redo your incorrects again. And then I would divide it by the okay, how many questions do I need to be doing every day? During when you're on the rotation during the week, you may not be able to do as many. Sometimes it may only be, and you won't need to if you start early. You may only need to be doing like 10 a day. But during your weekends, I think it's kind of going to be where you're going to be able to get a lot more done. So, on weekends, you can aim to do like at least a set of 40, Saturday, a set of 40, Sunday, especially if you're not on a rotation. where you have to come in over the weekend, which I think almost all rotations that I had, nobody really expected med students to come in on the weekend. So you really do get that weekend to study, which really changes when you're a resident. So enjoy it. Because we still have to study. We just don't get the weekends off to do it anymore.
Yeah.
um, so yeah, that would be my recommendation.
Yeah, I definitely agree. Some, rotations like psych, I would say, you could get away with doing maybe 10 per day, right? And then
Mm-hmm.
more on the weekends. Um, right. If I have to really put a number to it for like IM and surgery, I would say at least 20 questions per day.
Mm-hmm.
And, set aside time for that, right? As Alina said, it's important to plan for that and make sure that you set aside time for it and not brush it off because this, the knowledge really just builds over time. It's really hard to cram it in towards the end.
Yeah, and there's actually kind of studies that show that before you actually fully retain something for a lot of things, you need to review it around 5 times. Like that's the magic number. So be ready for kind of that process. If just because you've seen something once, don't expect to know it. This is why, spaced repetition and doing practice questions regularly, it's so, so important because by starting early and doing them consistently, you will have that amount of time to review all these topics kind of at multiple points in time, and that will really help with your retention. And you want to retain this stuff for the long term. You don't want it to be okay, shelf exam and it's over, right? Or step two and it's over. Especially things like medicine. I think almost no matter what kind of specialty you go into, you should still kind of have a good basic knowledge of like things like medicine or things like that, because it really will help you in residency too, and it will help you to be a better doctor overall. So really study for these things, like you're studying to take care of patients. Don't just study for them like studying for an exam, because these things really they do help you. Sometimes we think, oh, it's just like step two knowledge or COMLEX knowledge or shelf. It's so different. And yeah, there are things that are different, with what they want you to put on the test and what you do in practice, but having that good foundation really does help you, especially, when you're starting as an intern and really don't know anything. It really does kind of help you feel like, okay, you at least have some kind of basis of knowledge for how clinical decisions are made, or, how things are going to present in patients. So I know that was kind of more of a motivational speech, but hopefully that helps.
And as a helpful tip, I think, particularly for the shelves and for step two and level two, they're much more clinical, right? So you're going to get a lot of algorithms, a lot of flow charts, especially if you're using real world, and those are the
Mhm.
absolute gold. Sometimes I still
Mhm.
use those, I look those up, when I'm on my clinical rotations. What is the best next step in management,
Mhm.
right? So it's really helpful to understand those and why, the algorithm is the way it is, and really understand them in the context of a question. I think that'll help you both clinically and on the exam.
Yeah, absolutely. That's so true. And yeah, UWorld images, charts, tables, they really are gold. Even like for surgical stuff, I'll sometimes look up, images, and, believe it or not, some of the images there are stuff I'm not even going to find in a surgical textbook. So really, those are really, really great things to learn from. I think it's just such a good resource overall. So really take advantage of it, and use it to its full potential.
All right, maybe we give it another minute or
Mhm.
two if anyone has any last minute questions. Hopefully this session was helpful.
please feel free to drop any questions.
As you'll see in the chat, there's an email that you can reach out to us through if you have any other questions. I'm thinking we can wrap this up and call it a night. It's been a very successful webinar. I hope everybody got their questions answered.
Yeah, it was great.